Gaslighting, I feel like it became more of a popular term in recent years. From a medical standpoint, as the patient go into your doctor, your provider, and you're saying, I have this symptom, and this symptom, and that provider was like, oh, well, it's normal. Well, you shouldn't be experiencing that, but take no further action to evaluate or to treat those symptoms. My doctor still said everything looks fine. And in 15 weeks, I woke up wet. And without, the education that I needed, I didn't realize that it was fluid from my sac. And literally an hour before my gender reveal, I went to the bathroom and the baby fell out.
Welcome to Nurses with Voices. I'm Dr. Lendra, your host and fellow nurse who's traded in burnout for breakthroughs. I'm here to show you how to transform your nursing career into one filled with purpose, reduced stress, and incredible opportunities. Whether you're looking to start your own business, build generational wealth, or simply find a healthier role in nursing, this podcast is for you. Join me to explore practical strategies to overcome burnout, combat bias, and chart new paths in nursing. It's time to reclaim your voice and reimagine your future in healthcare. Let's get started. Welcome back to another episode of Nurses with Voices. I'm Dr. Lendra. Our guest today embodies resilience, advocacy, and transformation. She's a registered nurse, but also she's the founder of Light After 9. And I'll let her explain that. Light After 9 is a nonprofit dedicated to supporting families through pregnancy loss, infertility, and maternal trauma. So after enduring her own journey of 9 pregnancy losses, facing systemic bias and medical gaslighting, Rachell turned her pain into purpose. And I just love that, really creating a movement for equitable, compassionate care. Rachell, thank you so much for joining. I know we're like laughing and giggling as we're coming on, but that's nurses, right? Your personal journey through 9 pregnancy losses and your experience, as you can see, I'm just like jumping right in, right? So your experience with systemic bias and medical gaslighting is powerful. Can you share how these experiences shaped your decision to start a Light After 9 and what impact you hope the nonprofit will have on maternal health care?
Yeah, absolutely. And thanks for having me, Dr. James. That journey was very traumatic, from the care that I received to the actual pregnancies itself. And I don't want anybody to go through that. I know miscarriage is commonplace, stillbirth, unfortunately, is commonplace, but the amount of loss that I sustained was unnecessary in so many ways. And I could have lost my own life. So from like you said, the medical gaslighting to the lack of healthcare access. And I live in Atlanta. I live in a city. We have so many major hospitals. And during my 6th pregnancy, I literally, after a failed surgery, a failed cerclage placement because I had cervical insufficiency, had to fly to Dallas, Texas to get another surgery to try and save a 20-week pregnancy. That should never happen. And I'm not even in a rural area, so you can only imagine other patients and what they have to go through during pregnancy, which is the time we're closest to death as women, for most women, what we're experiencing. So those maternal health disparities, and I faced a lot of them in those 4 years of being pregnant, I just didn't want that to be commonplace for other women. So that's why I started the nonprofit after I took a year off of being unpregnant, to say the least. I was able to get my thoughts together and my mind together and decide to give something back.
Let's talk a little bit about the medical gaslighting. Explain to the listeners what you mean, or give an example of how were you gaslit as a patient, right? Being on the other end.
Right. So gaslighting, I feel like it became more of a popular term in recent years. So from a medical standpoint, you as the patient go into your doctor, your provider, and you're saying, I have this symptom, and this symptom. And that provider was like, oh, well, it's normal. Well, you shouldn't be experiencing that, but take no further action to evaluate or to treat those symptoms, or even telling you directly those are not the symptoms that you're experiencing. So During my pregnancy journey, I experienced a lot of these symptoms. During my second pregnancy, I was pregnant with twins, and I went to the ER when I found out I was pregnant initially after taking a pregnancy test at work because I was bleeding. And I was told that everything was fine. They did an ultrasound, everything was fine. I had twins, they didn't see anything. So I went to the doctor, the OBGYN, to follow up. My symptoms got worse. I started bleeding more, nausea, vomiting, and excruciating 10 out of 10 pain. And I was in and out of the OB's office and the ER 2 to 3 times a week. And nobody did anything but an ultrasound and maybe some lab tests, which was just a CBC, which is, not really any in-depth maternal health test or anything like that. And I kept getting sent home, kept being told nothing was wrong. My providers were not listening to my symptoms. I'm telling them I'm having excruciating pain. I'm asking for additional testing. And at 13 weeks, I lost my first baby. And I was devastated, but I was still pregnant, so I was still kind of hopeful. At 15 weeks, my symptoms subsided, but I didn't receive any further testing. My doctor still said everything looked fine. And at 15 weeks, I woke up wet. And without, the education that I needed, I didn't realize that it was fluid from my sac. And literally an hour before my gender reveal, I went to the bathroom and the baby fell out. I went to the ER and I'm telling the doctor, and the ER is the same ER that I've been to, had to be 13 times minimum during this pregnancy. And I told the doctor what happened. The first thing she asked me was, how do you know you were pregnant? I'm 15 weeks pregnant at this point. And I've been to this hospital 2 or 3 times a week throughout this pregnancy. And she had the nerve to ask me that. So I asked her, do you want to see the baby in the toilet? And she said, yes. I showed her a picture of the baby, and she said, oh, that's a baby. So, experiences like that would be considered medical gaslighting. And, I was told many times that my symptoms weren't as bad or, wasn't indicative of anything wrong with the pregnancy, or that I wasn't having the symptoms, or they even questioned if I was pregnant. And that's the type of things that I want patients to advocate for themselves to get the care that they need so they won't have the issues that I had.
Yeah, and maternal health is a pretty hot topic,
Yeah.
and especially in the recent presidential election,
Yes.
that was a huge topic with women's rights and having a
Yes.
voice in how we care for our bodies and us knowing our bodies. And
Right.
a topic that continued to come up or came up or comes up now even is trust.
Yeah.
And this is why we have such a hard time trusting our providers,
Right.
because when they're sitting there telling you nothing's wrong, when you know your body and
Right.
you know something's wrong, right? And when you talk about dealing with systemic biases, can you make the connection for the listeners for the bias that is all intertwined in all of this? These biases, for someone going through it, you ask yourself, like, what could I have done differently, or what can the provider have
Mm-hmm.
done differently? And that bias, it can be pretty traumatic, because every
Right.
pregnancy is different, right? And when you're being told everything's okay, and then it ends up being not okay,
Right.
that can really affect you mentally. Yeah.
Absolutely. Especially with the type of outcomes that, I had, repeatedly.
Right.
It's very traumatic for patients to feel like they're being gaslit, don't know if they are being gaslit. You want to trust your provider. You don't really know too much about what's going on with your body, but your symptoms are very real. And then the outcome is traumatic, like a pregnancy loss. It's unnerving. It's heartbreaking.
I can imagine, because I'm a nurse of over however many years. Maternal health is one area that I don't specialize in, right? So
Right.
that's not my specialty. So this is where I would need that education.
There are some biases that you're not completely aware of as a patient that's going on, right? When I first started my pregnancy journey, I was very adamant because of research showing that for Black women, when they're pregnant, they have better maternal health outcomes when their provider is Black. So I made it a point, just out of fear, after my first miscarriage. I had a home pregnancy test. I was bleeding. I went to the doctor, and I can't remember his race, but he wasn't Black. But it was a man, and he said, "Oh, you have a miscarriage, but you're going to have a healthy pregnancy journey. This is a part of the journey." Which, for me, that was far from the journey that I had. Like, far from the journey. So, when we're talking about bias, people look. I am a Black woman. The maternal health death rate for Black women is significantly higher than our counterparts. And the issues that we're facing, the lack of treatment, is significantly higher for Black women than all of our counterparts. So you have to think about the reason behind that. Biases take a part in there, lack of treatment, insurance, not covering everything, or we can't afford insurance, maternal health access deserts. There's a lot of issues that play a part in our outcomes. But bias, you have to think about racial bias. There are studies that show that there are providers who don't believe that Black women feel pain to a certain extent. So if you have this bias, then you aren't going to treat me effectively because you have your whatever thoughts that you have about me, your preconceived notions. So there are studies where they surveyed quite a few providers regarding Black women and pain, and there are a lot of providers who feel like Black women do not feel the pain that they say they're feeling, like it's a lower level of pain that they're portraying. And when you have a bias like that, you're not going to treat that patient effectively because you don't think their pain is real. So whether my counterpart is experiencing the exact same symptoms and issues that I have, they may receive morphine for their issue, where I get a Tylenol. And we know when you don't treat pain effectively, it interrupts your breathing, your healing, all these things.
It's true. And I've experienced this. I spoke at the Congressional Black Caucus back in September,
Okay.
and one of the things that we talked about was rooting out racism in healthcare.
Mm-hmm.
And how you address it and how you root it out is by addressing these biases. And pain was one of the subtopics that we talked about, and using the exact example that is used, and how there's a myth that we don't necessarily feel pain, like Black people in general don't necessarily feel pain the
Yeah.
way other people feel pain. And as a nurse, right, and someone who worked at the bedside for a long time, I can tell you that I've witnessed a 80-year-old gentleman who came in with a fractured hip versus a 38-year-old male who came in with some type of trauma, whether it was a motor vehicle accident, whatever it was. However, they're both trauma patients,
Right.
right? But why is it that we're giving this 80-year-old gentleman more medication than we're giving the 38-year-old male? Because what? Because the 30-year-old male should be able to
Right.
tolerate it. Yet this
Right.
80-year-old male, we run the risk of sending him into delirium because we're
Right.
giving him so much pain medication. So the math just doesn't math, right? It really doesn't. And it's just, when you talk about the biases, it's true, because the misconception, it has happened over and over and over again throughout
Yeah.
my career. I've witnessed it. I don't need evidence or
Yeah.
research studies to show me, because I've witnessed it.
Right.
But you have that climate and culture who they want to see the facts. Well, you know what? I
Right.
can give you the facts from my experience, right?
Right.
And and that kind of leads me to, we talked about, during, you mentioned that during the height of the COVID-19 pandemic, you worked as a travel nurse
I
in
did.
New York City, the epicenter, right? And
Yeah.
eventually this led to the creation of Onward Healthcare Solutions and Education. What gaps in healthcare compliance and informatics did you identify, and how does your company help address this?
Yeah. So, oh my goodness, when we talk about gaps, the the height of COVID-19 pandemic. Goodness, I mean that conversation is endless, but
Yes.
particularly I saw with smaller and even larger, but smaller healthcare companies really struggle to keep up with all of the recommendations by World Health Organization and CDC, DPH. All these governing bodies who are telling us what to do in this pandemic to treat our patients and our employees, ourselves. They couldn't keep up because it seemed like every day it was a new recommendation. So after I came back from New York, I actually got sick with COVID and had to end my assignment early. But when I came back, I'm like, man, we really are struggling in healthcare right now. And I created this company because I saw that deficit. And I said, if the hospitals are suffering, and we have infection control departments and departments who are geared to keep up with these things, I know our smaller healthcare entities are suffering, and they were. So I created Onward Healthcare Solutions and Education to implement workflows, policies and procedures. I wrote for them. I also made sure I kept up with all of the latest recommendations to give them ongoing training and implementing more workflows so their patients are safe, their employees are safe, and they're just abrupt on what's new, what's latest, what's the latest recommendation as of 24 hours or 48 hours ago.
Yeah.
And it really helped people.
That's awesome. That's awesome. And it was so needed because you're right. Because I can remember working in leadership at the time, and it was just like it got to the point where I was like, why are we even writing policies
Right.
anymore? It's like it's gonna change tomorrow. Like why are we
Tomorrow,
writing this
later
now?
on the
Like,
day.
yeah, in healthcare, we're so used to going to the policy, right? Going to the policy,
What the
having
policy say?
and it got to the point where it was like, why are we writing this down? Because it's going to
Right.
change tomorrow. Like it would
Right.
change throughout the day. Like my
It
staff would be
would.
like, really? I would be like, listen, do not. I am the messenger here. Look, and it just became listen. You started to adopt practice, and it was like, you know what? If they can't get it
Right.
together, how are we going to get it together? So
How?
that was when we had to start really forming our own coalition, and
Mm,
not that we were throwing anything out the window, but we
right.
had to really like band together. And I think that's why a lot of people who work together during COVID, like they have certain bonds
Oh
now
yeah.
that is just, it's almost like the bond that you had when you first started nursing, like that
Yeah.
group of nurses that you work
Yep.
with in the beginning. And you
Yep.
guys have like this, or your nursing student,
Mm-hmm. Yeah, your study
your
group and
nursing student
everything.
peers. It's like, it's kind of like the same thing with COVID. It's like when you
Yeah.
work during the pandemic, it's like you created this bond that, I mean, I still have friends in Chicago
Mm-hmm.
that we worked together during COVID, and like those are my girls. I say all this to say, COVID-19 was such a challenging time, and I commend you for really stepping up because that was a time when we needed that. We
Yeah.
really did. And I want to switch gears a little bit and switch back to maternal health. And as a maternal health advocate, you've seen firsthand the disparities in care for women,
Mm-hmm.
particularly how those from marginalized groups. What changes do you believe are most urgent, right, to ensure equitable and compassionate maternal care? And it kind of is piggybacking off of the what I mentioned earlier about the candidacy, right, the presidential candidacy and the hot
Yeah.
topic of maternal health. So, what are your thoughts about it? What do you think needs to really change?
Dr. James, that's a loaded question you just asked me because you're
I
asking me
know, like let's
to
just
prioritize.
unpack it a little bit. Like what I
You're
know
asking
it's
me
such
to
a loaded question. I
prioritize.
should have started with that, right?
Goodness. Oh goodness, if I have to pick an issue, Jesus, let me figure out my scroll.
Pick one. Look,
Right. I have to pick.
pick one.
I mean, let's do a political and then just another one. But from a political standpoint, goodness, I am scared for the next 4 years. As a woman, as a just transparently, like I made sure I got my tubes tied. So because I can't even be pregnant anymore because I would die if I was pregnant. Because the aftermath of pregnancy it just got really bad. So I had to get my tubes tied because as we know the abortion laws are just antiquated. In Georgia, you have to, get an abortion by a week before the heartbeat, which a lot of women don't even know they're pregnant by that time. You don't even know you're pregnant. Unless you're somebody who's like me who had issues and, you can test after ovulation in certain days and, or IVF, but you don't know you're pregnant. So my life would be at risk if I was to be pregnant and not be adamant about testing after, a week or so from conception. It's just crazy. So those laws need to change because abortion care is also miscarriage care in a lot of cases. During my pregnancy, where that baby fell in the toilet in my sixth pregnancy, that twin loss, I had to take an abortion pill to get the rest of the placenta out of me, all these things. But under the new laws and the changes in law and overturning Roe versus Wade, I wouldn't have had that luxury, and I could have died from an infection. So a lot of things have to change. A lot of things, but it starts with that for sure.
For sure. And I thank you for sharing that. And I think what you said is so powerful, and it means a lot, because when we talk about the government and everyone else having control over our bodies, it's a strong issue. And if you're not a woman, just like how some people say, well, I can't understand whatever bias you went through because I never dealt with that, right? It's the same thing when it comes to Roe versus Wade, right? The fact that someone else can dictate what we do with our bodies is kind of the same thing that we deal with bias. And to a degree, if you really want to unpack it, it is a level of bias that certain people are making certain decisions for a group of people and they shouldn't. So I do thank you for sharing that, because I know that is a level of vulnerability and transparency to share that I've had 9 pregnancies and I had to go through this. And to your point, we may not be having this conversation right now. How many children do you have now?
And he just turned 2 on the 30th of December. But I have one baby, one live baby.
I love that. It makes it all worth it, right? Like, you had definitely had some challenges that you went through, but you came out with this bundle of joy who's now 2 years
Yes,
old.
he is truly a bundle of joy. A very easy baby. I mean, finally the universe, God blessed me with something because it was a struggle to get him here. But when I tell you the easiest, just feed him and he's fine. He's that type. He don't care what happens after that. Just feed
Boys
him.
are usually like that. Boys are usually like, just listen. My son was like no problem. I'm talking from delivery to like growing up to like even backing up to like sleeping through the night. Like,
Yes.
he was like this child that slept through the night. And I can remember I worked nights when I first had him. When I went back to work, I went back to the night shift, and my mother would watch him, and she would, I would come home and she would just be like, he slept through the night. I'm like, no, he didn't. It's like, yes, he did. And then my nights off, I would see. So to me, if you're a newborn baby, less than 6 months or 6 months or more, and you're sleeping till like 4 or 5 o'clock in the morning, that's sleeping through the night.
Oh, that's sleeping through the night. it's not, no doubt about that. That's sleeping through the night.
That is sleeping through the night. Listen, so for nurses listening who may feel, inspired by your journey, right, but are unsure how to turn their own challenges into a mission or a business, because that's what you did. So you basically took your challenge and you turned it into a nonprofit. What you know what advice would you give them to help them get started and create meaningful change in healthcare?
The first advice is to literally do exactly what you say and get started. Because we feel like everything has to be perfect. Perfect time, perfect product, service, perfect plan to release it. And there's never going to be a perfect time. It's not. You don't have to have $1 million. There are so many people and companies that are waiting for you to start that service, that idea that you have. And you're just holding it from us, from the rest of the world. So don't be afraid. Move forward with confidence and literally do that. Just at least start it. And prepare to fail. Prepare to fail over and over again. And you don't really fail unless you just don't learn a lesson or you just give up completely. But you're going to make mistakes. Be comfortable making mistakes and growing from them, because it's going to happen. You don't know everything. But as far as my nurses, just from experience from starting this nonprofit and my for-profit, which I started in 2020, the nursing community is the most, we're like the mother of communities. We're like, oh, you have an idea, you're starting a company, come here, let me hold you and let me, help you water your seeds of entrepreneurship. We are like that. So you already have support before you even started. So just start it. Truly, truly, truly just start it. We're going to welcome you and, make mistakes and learn from them and do the best that you can. But just get started.
And and if I didn't ask this, forgive me. What exactly do you do with your nonprofit?
Yeah, so my nonprofit, A Light After Nine, I named it that because I had 9 pregnancy losses. My baby was definitely the light. Also, just getting over that hump was a light. You know, I wanted to start a nonprofit to help others on their difficult pregnancy journey, which unfortunately is a lot of birthers. So we do a lot for our mothers, our birthers, and their village. We give them resources that they need, whether it's mental health, finding doctors and vetting them, making sure there's something on their records that should be alarming. We have a mom-to-mom mentorship program. So if you're a mom who's been there, done that on the other side, or you're a mom who's like, I need somebody to hold my hand, we can pair you together so you have somebody to walk through that journey with you. We also give grants and find grants for you and help you fill out that paperwork because it's expensive. Whether you're going through a loss or you made it through or the baby is in the NICU, it is expensive. So we help with that. And then on the other side, business to business, we partner with hospitals and in smaller OB clinics and maternal health clinics to change how we approach maternal health. And we do that by offering palliative and supportive care at the bedside and then post discharge case management after discharge. Or I say post discharge case management. That is so important, Dr. James, because once we get discharged from the hospital, we might hear follow with your OB, and that's it. Nobody's following us after, and that's if you have like a further along miscarriage. God forbid you have an early miscarriage. It's no follow up. Nobody's checking in on you. Nobody's making sure you schedule with that specialist or follow up with that OB or even have an OB or even know how to get a referral for that specialist or if you need one. Nobody's doing that. So we're left with these balls that are dropped that can cause us our lives and our baby's life. So we do that and make sure that doesn't happen anymore.
So do you do virtual as well as in home?
So we don't do in-home, but we do virtual visits. We do phone, Zoom visits. So we do telehealth.
Nice. Okay, so you do telehealth. That's
Yeah.
amazing. Good for you. And you know what? If you don't mind, can you share the steps on starting a nonprofit?
Yeah, absolutely. So nonprofit, you want to file your articles with your state, which is probably the easiest part
Mhm.
for nonprofit. Come up with your name, make sure it's not taken, and file that paperwork. Usually with the Secretary of State. Then you want to make sure you get your logo, trademark it. Don't let anybody steal your stuff. Trademark your model. Come up with your mission. Get your board together because then, not everybody, but you're more than likely going to want to file your full one C3, which is your ability to file exempt with the IRS. There's two different kinds. There's an easy application, which is for those who are planning to make less than $50,000, and then the other application where you can make more than $50,000. I'm gonna go big or go home, type person. So we making more than 50,000. We're bringing in more than that. But you want to do that so you can have that exemption status with the IRS. Um, but other things you can do, and I always encourage you to get with a lawyer too, because the paperwork could be kind of complicated. You have to have a lot of things that you have to that come along with that paperwork. But making sure you copyright, for me, my speech. I turn my pregnancy journey into an interactive case study where the audience, and if you ever get to see me speak, the audience will decide which care options should have been chosen. We know that the care option that is less favorable is not going to be chosen, but that's the one that, occurred in my pregnancy. So in real life, you get to see maternal health disparities at every level. for pregnancy. So you want to get things like that that's meaningful copyright. So yeah, it's quite a few processes. There are a lot of organizations out here to help, like SBA, Small Business Association. There are a lot of grants out here. Go on grants.gov, and a lot of other nonprofits also offer grants. You could do sponsorships. It's a lot you can do out here in the nonprofit world.
I love it. Well, thank you so much for coming on and sharing your
Yeah.
journey. This has been good. Thank you so much. We definitely have to collaborate in the
Yeah.
future. We have to like think. I'm always like my head is always going like, how can we work together? Like I'm always
Same
like,
here.
how can we work together? Like that's one thing that people know about me. Like I'm always looking to like, how can we work together? Like
Yeah.
like my mind is always going. I gotta stop it. But no, this has been absolutely amazing. Thank you so much for sharing your journey.
Yeah.
How can people find you?
Yeah, absolutely. We are on all platforms except for X. We're on TikTok as well, which I don't even know if that's going to be around, but on TikTok
No,
it's R it's R Dumas.
now.
Right for
TikTok
now.
for now.
Definitely on LinkedIn. That's probably one of my favorites. You could just find me at Rachell Dumas. On Instagram, we're a light after 9. Threads a light after 9. And Facebook, Rachell Dumas. You can find me there. We also have a website called alightafternine.org, and you can reach us there. We have our email on there and our telephone number. So feel free to call us and follow us, DM us, and we'll be happy to help or partnership, whatever one suits your fancy.
And I love her NOLA accent, guys. I wonder if you catch it. Like I have like really good friends from New Orleans. So just
Really?
listening to her, I feel like I'm listening to my friends. So shout out to Dina Daya.
I toned it down though, so you can
Look,
understand me.
look, tone it down. Look, listen, I love it.
Because if I really talk to my accent, you'll be like, okay, we can't do this
Like
podcast.
New Orleans, New Orleans. All right. Well, listen. All right, guys. Well, until next time, this has been absolutely fun. Thank you so much for coming on. Until next time, make sure that you guys stay inspired, stay educated, and stay empowered.